good morning, and welcome to Inside the News right here on WINN FM 98.9. Today is a super Saturday. It's Saturday, January 16th, and you are listening to Inside the News on your radio station. This is WINN FM 98.9. Of course, I am Devon Cornelius, and I am being joined with Kevon Brown.
Good morning, listening audience.
Great. Today, for the first hour, we will be taking a general look at the COVID-19 situation closer to home, Barbados and St. Vincent and the Grenadines. And we will be going out into the international community, taking a look at what is happening there. So I will allow Kevon to give his opening remarks, and we are going to continue. Yes, come on.
Opening remarks, as if I'm an official giving a briefing.
Yes.
Welcome to another edition of Inside the News, and I just want to say a hearty thank you to our sponsors for Inside the News today, which are TDC, The Cable, and Cara Brewery. Thank you so much for sponsoring Inside the News.
Honey, I have so much to do, and now I need to go to TDC Home and Building Depot to buy the new fridge.
Samantha, stop worrying. You can purchase the fridge and whatever else you may need with TDC Home and Building Depot's curbside and delivery service.
Really?
Just send your request via WhatsApp or email, pay online, and get your purchase by pickup or delivery.
Wow! I'm going to try TDC curbside and delivery service now.
Terms and conditions apply. Check our social media pages for all the details.
At The Cable, we know being local means supporting our own, and our customers deserve the best. Our customers deserve platinum. So now, all customers of The Cable qualify for our new Platinum Loyalty Card. An elite MasterCard experience that lets you support your own like never before. Instantly send money to any Platinum Loyalty member at home or around the world. Shop online or in person anywhere MasterCard is accepted. Save with no interest and 0 annual fees. And the best part? If you're a Cable customer, you are already pre-approved. Just visit the Cable building in Bastere or sign up online at www.thecable.net. Get your Platinum Loyalty Card today because you deserve platinum. Terms and conditions apply.
Maybe it's the way the brilliant gold liquid reflects our sunshine, or how the bright blue of its lake mirrors the clear Caribbean skies overhead. Maybe it's the fresh, crisp taste of this beastly cold beer on a scorching hot day. Maybe it's even the way it brings us all together. But one thing is for sure, Carib is very much a part of who we are wherever we're from in the Caribbean. Carib, it's the way we play. Drink responsibly.
People make the world go
Welcome back to Inside the News, and thank you again to our sponsors, The Cable, Cara Brewery, and TDC. As my eloquent host mentioned before, we're going to be speaking about COVID-19 on an international level, and then, briefly on an international level, and then bringing the situation back home in the Caribbean region, and then specifically to St Kitts and Nevis. Firstly, as we were made aware in the last week, effective January 7th, all air travelers 5 years or older are required to provide proof of a negative COVID-19 test prior to boarding international flights bound for Canada. A similar move was made by the UK, which came into effect yesterday, January 15th, that all travelers needed to provide proof of a negative COVID-19 test before they are allowed into the country. And then effective, interestingly enough, after the inauguration on January 26th, the same stipulations apply for the U.S. All inbound travelers to the U.S. must provide the airline must provide documentation of negative laboratory tests. And the prior approval practice, these forms of prior approval practices have been adopted by the region since the start of the pandemic, basically, within the Caribbean region. However, the seemingly increasing numbers in the amount of cases spread throughout the US, Canada, and the UK, probably as a result of the new variant, which is, according to officials, 50 to 70% more transmissible. These new stipulations are probably a way or one of their efforts to help curb that new contagious variant that was basically it was basically indoctrinated or incubated in the UK. We could use that word. That's a good word. It was incubated in the UK, which is quite unfortunate. So the US decided to take those precautions. The US, the UK, Canada decided to take those precautions. But for a more tunneled look on the situation, I want to bring us back to our region. It still encompasses Canada and the US, because we're going to listen to a bit of the situation report, the COVID-19 situation report from the Pan American Health Organization, the director, Carissa Etienne, her clip on giving us a briefing on what the situation is within the Pan American region. And we're going to pull that clip right up.
A very good morning to all of you and Happy New Year. Welcome to the first meeting, first media briefing for 2021. And PAHO is grateful to you for joining us once again. Since the start of this pandemic, over 39 million people across the Americas have become infected by COVID-19. And over 925,000 of them have succumbed to the virus. In the last week alone, 2.5 million people were infected with COVID-19 in our region, the highest weekly cases since the virus first reached our shores. Virtually every country in the Americas is seeing an acceleration in the virus's spread. In North America, the United States is reporting the highest new COVID-19 infections and deaths in our region. California and states across the American South have seen dramatic increases in COVID hospitalizations, with 13 states reporting record-breaking figures. Today, more than 132,000 are hospitalized from COVID-19 in the United States. These are more hospitalizations than during the pandemic peak in the spring and the summer. These trends in hospitalizations are also being reported in Canada and Mexico, where the local health systems are struggling to keep up with demand in care. For the South and Central America, data from early January suggests that infections are on the rise in Costa Rica and Belize. However, it's too early to tell the impact of the holiday season on the virus's spread. So we are going to have to remain vigilant over the next few weeks. Across the Caribbean, data from early January reveals that many islands saw rapid rises in infections. The Cayman Islands, Dominica, and the Virgin Islands reported a doubling of cases within the last week alone. And cases are growing even more rapidly in Barbados, St. Vincent and the Grenadines, and Bonaire. And as we move to South America, every country has reported a rise in cases over the last few weeks, even in countries that had seen a decline in cases, like Chile and Argentina. As our Southern Hemisphere experiences its summer months, many countries are struggling to limit gatherings and travel which will most likely fuel infections for weeks and months to come. Scientists throughout the world and our region have also detected new variants of the COVID-19 virus. PAHO's molecular surveillance network spans some 21 laboratories throughout our vast region, and we're tracking the spread of the virus and mutations that naturally develop over time. So far, the variant first seen circulating in the United Kingdom has been reported in 6 countries in the Americas. At this time, there is no evidence to suggest that these variants affect patients differently, but early data does suggest that the virus can spread more easily, accelerating the threat to our health systems at a time in which they are already close to capacity. And that's why the public health measures that we've been urging from the start, such as practicing social distancing, wearing masks in public, and washing hands often, remain our very best bet to help control the virus right now in all of its forms. So let's look at the year ahead. Our collective ability to keep up with these measures has the power to determine the trajectory of this year. If we remain diligent, we have the power to control this virus. If we relax, make no mistake, 2021 could well be far worse than 2020. With one vaccine approved for use by the World Health Organization and more underway, we're moving closer to controlling this pandemic. A handful of countries in our region have already begun vaccinating health professionals, and a few have already started protecting other particularly vulnerable populations, like the elderly and those with underlying conditions. However, as long as doses remain limited, we cannot rely on vaccinations to flatten the pandemic curve. As we look ahead to 2021, I would say that there are 3 priorities that are critical to controlling this pandemic in our region. The first is to ensure equitable access to the tools, both new and old, to prevent and treat COVID-19. We must ensure that health workers have the protective gear and equipment that they need to do their job safely, and that every person who requires hospitalization can access the basic medications they need, ICU beds if that is necessary, to manage and treat the conditions. This is especially challenging as cases surge and supply chains are strained. With the arrival of vaccines, we must ensure not just that doses are produced quickly, but they are equitably delivered and swiftly across every country, regardless of income. This will require global and regional collaboration and solidarity, with donors pitching in resources through mechanisms like the COVAX facility. Second, we need leaders to act quickly and foster unity. This pandemic has taught us time and time again that leadership determines the effectiveness of a country's response. As we look to the year ahead, leaders will face difficult choices as we work to flatten the transmission curve. And that's why we need leaders to act transparently so that the public understands their decisions and the scientific evidence that is behind those decisions, so we can rally people around a shared plan. We need leaders to act in the interest of public health, not political gain, by working together to make the best use of the tools to prevent this virus. Politicizing vaccines and other control measures is not just unhelpful, but it could fuel the virus and cost lives. And finally, we must balance urgency with good planning. We don't have much time to lose, but we cannot beat the pandemic without strong vaccine delivery plans. And that's why PAHO is working with every country in our region to help secure the vaccine doses that countries need to protect their populations. We're also providing support with vaccine demand planning, logistics and cold chain management, surveillance and information system strengthening, health worker training, and vaccine communication planning, among others. Luckily, our region has a strong legacy of immunization and the mounting of immunization campaigns. Thanks to vaccination and surveillance efforts, the region of the America was the first in the world to eliminate smallpox, polio, rubella, congenital rubella syndrome, and measles. For 42 years, PAHO's immunization program has helped countries across the Americas work together to protect people against vaccine-preventable diseases. Through our revolving fund, member states pool their national resources to procure vaccines and related products at the lowest price. COVID will be a challenge, but one I believe that we can meet by working together.
At The Cable, we know being local means supporting our own, and our customers deserve the best. Our customers deserve platinum. So now, all customers of The Cable qualify for our new Platinum Loyalty Card. An elite MasterCard experience that lets you support your own like never before. Instantly send money to any Platinum Loyalty member at home or around the world. Shop online or in person anywhere MasterCard is accepted. Save with no interest and 0 annual fees. And the best part? If you're a Cable customer, you are already pre-approved. Just visit the Cable building in Bastere or sign up online at www.thecable.net. Get your Platinum Loyalty Card today because you deserve platinum. Terms and conditions apply.
Maybe it's the way the brilliant gold liquid reflects our sunshine, or how the bright blue of its label mirrors the clear Caribbean skies overhead. Maybe it's the fresh, crisp taste of this beastly cold beer on a scorching hot day. Maybe it's even the way it brings us all together. But one thing is for sure, Carib is very much a part of who we are wherever we're from in the Caribbean. Carib, it's the way we play. Drink responsibly.
Gift for Dad's birthday? Click. Ooh, Janice's retirement party? Click. Outfit for my girl's wedding? Click.
With TDC Airbox, you click, we ship. Register for your free U.S. mailbox today and shop all your favorite stores online. Enjoy the convenience, free consolidation up to £10, competitive rates, free package tracking account with live notifications, free delivery, and of course, excellent customer service. Visit our website at tdcairbox.com and register today. For more information, visit our offices at the C.A. Paul Industrial Site in St. Kitts and Penny's Industrial Site in Nevis. Follow us on social media at TDC Airbox. TDC Airbox. You click, we ship. Terms and conditions apply.
People make the world go
To Inside, welcome back to Inside the News right here on WINN FM 98.9. You were just listening to Carissa Etienne. She is the director of the Pan American Health Organization, PAHO, and she was providing an update on the COVID-19 situation happening around the world. For those of you who would want to be a part of this program, of course, you can call us via our phone lines at 466-0989, 762-0989, and 662-0989. And of course, we are now going to WhatsApp, so you can send your questions, your queries, your comments via WhatsApp at 662-2204. So you can send us a message, your questions, your comments, your concerns via WhatsApp at 662-2204. And of course, we are live on Facebook at WINNMedia SKN, and we will be monitoring the Facebook Live. You can pose your questions and your comments there, and we will be taking a look at your comments, and we will respond accordingly. At this time, we are not taking, and of course, we are live on YouTube as well. We are live on Facebook and YouTube, and we are now taking your questions and your input via WhatsApp. Again, the number is 662-2204. 662-2204. I will now hand back over to Kevon, and he will give his input.
Yes.
You want to get you up again?
Thank you, Devon. Not really. Not really. It's very professional this morning. First, you said I had remarks as if I'm an official giving a press conference or something. It's a very official way of looking at things. But yes, we welcome any input that from the listening audience concerning concerning the COVID-19 situation within the region, or anything that you heard Director of PAHO, Ms. Etienne, spoke about, or anything that we're going to be speaking about. Continuing in that same vein, Etienne also mentioned in her address, the first address of 2021 from PAHO, that deployment of vaccines in the Caribbean and other countries across the America from the COVAX facility is expected to get underway by the end of March. Similar sentiments were said by the PM on several occasions, saying that at the earliest, the end of the first quarter of 2021, and the latest, the second quarter of 2021. And initially, 2 billion vaccine doses have been secured from Pfizer under COVAX, and the distribution globally is for 2021, with an additional 1.3 billion doses expected to be disseminated in 2022. When I read that information, I was like, wow, that it suggests that global health officials are expecting this battle of COVID-19 to continue through 2022.
Well, I agree with them, if I may add, Kevin. I agree with them. I don't think, I'm not a medical professional, but looking at the situation, I don't think COVID is going anywhere anytime soon. And so for those of us who think, well, I made a bet with someone. They said that the pandemic will be completely over by March of 2021. The bet was $100, so I think...
Well, I think you're on your way to winning $100.
Definitely. I said, March? They said, yes. Yes, by March. I mean, I remember I made a bet last year saying that the pandemic would be over by August of 2020. We're now in January of 2021.
Correct. Very correct.
So the pandemic is still here, but I think I stand to get that $100. And if I do, I might.
I think you stand a very good chance, honestly. And too bad you didn't up the ante when you had the chance, because I think it's a bit too late now to try and up the ante, because it's already pretty, pretty concrete that you're going to win that $100.
Yeah, definitely.
But bringing it even closer to the region, apart from that very regional Americas and Caribbean, Pan-American grasp from Ms. Etienne. In Barbados, Prime Minister Mia Mottley, her Minister of Health, Jeffrey Bostic, Attorney General in Barbados, Dale Marshall, and 5 frontline workers received their first jab of the 2-course vaccine in the last week, and are expected to get the second jab I love the word. I love that word. That word has been circulating. Jab. If you watch boxing, you know what a jab is. That doesn't really sound that comforting, but they're expected to get the second jab in a few weeks. As we know, with most of the vaccines that have been rolled out for emergency use, they come in 2 doses. Pfizer, I think you get the second dose after 3 weeks, and Moderna, I think you get the second dose after 4 weeks. Currently in Barbados, there are 1,036 cases. According to the numbers we have, 1,036 cases with 493 recoveries, suggesting some 500 odd active cases and 7 deaths.
Yes.
And that is quite unfortunate, and that is as a result of the super spreader incident that occurred 2 weeks ago.
I think it was a little over 2 weeks ago.
Yeah, in Barbados, that affected the country and has drastically increased the amount of cases compared to how the cases looked prior. And Mia Mottley, the Prime Minister of Barbados, said Barbados expects to receive vaccine doses throughout through the COVAX facility as much of the region as with many other countries within the region, to make available 2 billion doses of safe and effective inoculations by the end of this year. And that's Miss Motley speaking in terms of Barbados. They're expecting safe and effective inoculations by the end of this year. But then she went on to say that even without that, the Ministry of Foreign Affairs and the Ministry of Health said that for the frontline workers, they might get their first jabs by the end of January or early February. And that is in an effort to help the frontline workers continue combating the COVID-19 situation. And that brought to mind a thought in my head. Because if anybody's been paying attention to what other health officials have been saying globally, there has been talk of this concept of herd immunity, and we had a similar conversation with Dr. Cameron Wilkinson some time ago about herd immunity, and that is essentially getting everyone in the world inoculated for the COVID-19, essentially getting everybody in the world inoculated from the COVID-19 vaccine to stop its spread, full stop. However, the dispensation or the rate of distribution for the vaccines and the specific people that have been getting the vaccines, and the new variants and some reports of the variants might be able to bypass certain vaccines. This whole situation has brought the question of how far away are we from herd immunity? And I think it speaks volume based on the projections that we will still be combating this in 2022, that herd immunity is very much, unfortunately, and it is very unfortunate that it's a far-reaching goal, herd immunity. What are your thoughts on that?
Well, looking at the entire situation, Kevin, as I said earlier, I know, or I don't think COVID is going to go anywhere anytime soon. As I said, the persons are of the opinion that, COVID is going to be here for the next couple months, and by a certain time, it's over and we're back to normal. I think those...
Normal.
Yeah, I think I don't think they're following the situation. I think we're just looking at the region. We're just looking at our Caribbean brothers and sisters, and we're saying, okay, they're not doing bad, and so COVID is going to go away. But we have to understand, Kevon, that the Caribbean depends very heavily on the international community. We receive travelers and visitors from the UK, from the United States, from Europe, and those other large countries. Correct. So if they continue to suffer, if they continue to not do as well as we expected, then it's going to get worse for us here in the Caribbean. I don't want to sound like I'm just sharing bad news, but it's the reality. It's definitely reality. COVID is going to be here. The health professionals are monitoring the situation and they are making preparations for 2022. They are making preparations for 2022, noting that this pandemic began in 2019.
Yes.
This pandemic began in 2019. It didn't get to our shores until March of 2020.
Correct.
I remember when I was at work, I heard people talking about COVID-19 in China. There was an outbreak in Wuhan, China. And I'm like, what y'all talking about? What is COVID? That was since 2019. And we are hearing from the health authorities, from the health officials, that they're making plans for 2022. So one can only understand the seriousness of the pandemic. Your take, Kevin?
But before that, we have a caller. We unfortunately lost that caller, but you can come back and share your thoughts on the subject. You said it all, essentially. We can't expect that the situation will get any better anytime soon, considering it's a global situation. It's very much a global situation. And early on, I was of the opinion, and this is very much my opinion, that at the first instance that this pandemic began to leave the borders of China and was seen in other countries, that countries should have shut down for 2 weeks.
Yeah.
That was my opinion when I was starting to get more information about it. I think it was around the same time that we closed our borders, but other countries didn't close their borders at around the same time. So nobody was really closing their borders, and people were still traveling and whatever. But I guess I am too. I am not aware of the economic impact of what I'm suggesting, that the world just stopped for 2 weeks. If the world had stopped for 2 weeks, it would have gone through its incubation period. It would not have reached as many people. It would not have gotten the chance to mutate as much as it's mutated, and it's continuing to mutate. Then that's just my opinion. If the world had stopped when it first started to spread globally for 2 weeks, the entirety of the world collectively stopped for 2 weeks, it might have stopped it. But that's just me. Again, my opinion. I am not an expert. I am not an expert in any way, shape, or form in the economics of the situation, in the medical aspects of the situation. I am not an expert, but that's just my opinion on the situation.
And, if I may, Kevin, I agree with you. I share the same sentiment. I think the world responded very slow to the pandemic, in my humble opinion. Countries were still operating as if everything was normal and everything was okay.
Even though the word pandemic was already being thrown around
since
in the
January,
early stages. Yes.
Since January, and officials were taking this whole COVID-19 situation for granted. There are still people, Kevin, who are taking this situation for granted, and they're saying, okay, yeah, we understand it's a pandemic and all of that. We have a call. Let's take this caller. Good morning, caller. You are on Inside the News.
Good morning, Kevin and Devon.
Good morning.
Good morning.
Happy Saturday to you and to all the listeners at home and abroad.
Same to you.
Same to you.
I want to give God thanks for another day, brought us to another week. I missed what the lady said, but I was listening this morning on the television, and the matter of the vaccine distribution was being discussed as to who gets what and when. And while we may be looking for it at March, it most likely will be June. Because, for one, they were talking about the the rate of inoculation in the developed countries. They thought they'd be further on. And the determination of the larger countries to ensure that some of them looking at the entire population being vaccinated. You could imagine that? So even though we put up our money, we don't have the political power to demand. And so our economy may be in malaise for a longer period of time. And I even heard one of them was saying, I think it was in California or whatever, they intend to make it compulsory for children to have it, to go back to school full time. So while we were just looking at the at-risk group, they're now saying, look, we want to vaccinate the children. You don't have it, you can't come. Now, another thing that they're engaging in is that they are discrediting any vaccine that they do not support, maybe the political system. You'd have heard about Russia has a vaccine, China has one, and there is an all-out campaign to discredit it. Before, I think the best thing they could do would to assist with the accreditation, get it checked. You know what I mean?
Mm-hmm.
Rather than saying, well, it don't make sense to take any from China or from Russia. And then we are left, and what are we to do? So have you thought about it? So as far as I'm concerned, the recovery of our economy most likely will take longer than we expect. All right, then.
Thank you. Thank you so much for your input, caller. Just to mention again, we are also taking your questions, inquiries via WhatsApp at 662-2204. 662-2204. Kevon?
Yes, and as our caller was brought up, the impact of COVID-19 has been far-reaching. We've all seen it, we've all heard it. Apart from the deaths, a lot of industries have suffered, and when we're speaking specifically to St Kitts and Nevis, one of our leading industries, one of our leading economic revenue streams, tourism has been hit, as many other Caribbean islands, where we can't have an influx of persons coming into the country as tourists, no cruise ships, and that has also stifled the tourism industry, hoteliers, vendors, tourist attractions, the activities that different tourists go. All aspects of tourism has been touched, and it has also affected the rest of the economy as well. We saw that the education system had to shift a little bit to accommodate the students who were supposed to be taking CXC and CSEC, CAPE and the CSEC exams last year. Sorry. It affected how that was done, and regional leaders had to come together to figure out how exactly these exams are going to be disseminated to their students so that their students could graduate on time. So our caller is very much correct in the fact that it will take a considerable amount of time before the economy all of the world's economy can get back to the position it was before COVID-19 happened. Now we're gonna shift gears to a more local look. Locally, the latest numbers that we have, we're at 34 cases with 32 recoveries and no deaths. And that is, I think, a testament to the protocols that we have in place here, although seen as stringent or strict or often described as too much, although they are strict, they are the reason why we do have such low numbers.
Definitely.
And it's yes, it's a testament to the work that the people at the NEOC and the HEOC have been doing. Now, at the Prime Minister's press conference at the NEMA conference room on January 14th, Attorney General Vincent Byron, he gave some comments on St. Kitts and Nevis' approach to the virus, and we're going to listen to that clip now from Attorney General Vincent Byron.
We are very proud here in St. Kitts and Nevis that we have led the way in terms of best practices in our response to this pandemic that has had such a devastating toll in much more advanced countries, first world, in our Caribbean region. And we here in St. Kitts have been able to manage the process very well. And we must give all commendation to the work done by our medical experts, led by the CMO, Dr. Laws, ably supported by members of the Health Emergency Operating Center, as well as the National Task Force. That is a subset of the Mitigation Council, Disaster Mitigation Council of St. Kitts and Nevis. They all work very tirelessly around the clock, and they too need commendation, whether it's the Chief Immigration Officer, whether it's the Commissioner of Police, Commander Defense Force. We have people at the Customs, Controller, his Deputy Controller, and a whole wide range of public servants who have had tireless, sleepless nights to keep us here safe in St. Kitts and Nevis. The idea is that when one comes here, one may have the COVID virus. It may be transmitted to other citizens, and it would have the effect of making our country, or putting many people, as it was, out of work. Businesses may have to close. There would be a lockdown. Economic activity could grind to a halt. So keeping us safe, keeping us healthy, helps us economically as well. And there has been this debate, this balance. To what extent do we have restrictions as opposed to safety and health? But we believe that our people's health should be a major priority, our number one priority. And we think that we have done a good job to date. The visitor who comes to St. Kitts, whether returning national or an international visitor, each of them is subject to a quarantine for 14 days. If you are a returning national, you can go to a government quarantine site where you would have no contact with relatives or others who are in the local field. If you're returning national, though, you may also opt to go to a second option that is available to international visitors, and that is you can be quarantined in a vacation in place, a staycation at a prescribed hotel. These are the Park Hyatt, the Royal St. Kitts, the Marriott vacation, as well as Four Seasons Paradise Beach in Nevis, where you are able to stay at the hotel in quarantine, but are able to participate in a limited number of facilities in the hotel. Such, you may have meals, you may go to a beach, you are in a bubble, and that is, you do not come into contact as such with the local population, with our local people. So that if, while in quarantine, you may have the virus, we are trying to protect our local population from any transmission. this has worked well so far. As I understand your question, is that there was a breach, and this at one of our hotels, where 2 individuals had the virus and had been isolated. They were separated from the body, and therefore they should not have come in contact with anyone. We understand that near the end of the 14-day or the period of quarantine, one individual found a way to make his way to the airport to try to get on the airplane. And during that visit, that travel to the airport, it was discovered and alarm bells went off. As you say, it was one that was embarrassing for the hotel, and they have since strengthened their protocols, their systems, to ensure that there is verification on who can leave and who cannot leave. But we are happy to say that our security systems worked. They responded immediately. The task force was able to get that person at the airport, isolate them, identify them, and they were moved to a government quarantine site where much more strict protocols were then put in place. We believe that our systems have worked very well. We have put in place a compliance team of other public servants who go and visit the sites, who respond to queries by the hoteliers and workers to ensure that we maintain these strict divisions between those who may be carriers of the virus and our local workers, our local staff, the local population. We have seen in some of our neighboring islands where workers at a hotel may have gone to their homes and carried that virus to their homes. The family then goes and meets at school and on the job. In Barbados, in St. Lucia, we have seen where there's been community spread as a result. And hundreds of people are now contracting the virus. Here in St Kitts and Nevis, we have been able to manage it. And we want the support of all our people to ensure that they do the basic protocols, that they support the compliance teams, that they support the National Task Force, because we believe that there's only a short while to go before we are able to get what the Prime Minister discussed earlier, our access to a vaccine that we can spread in our community and make us even better to combat the virus if, perchance, it was to come here and get into our society. But we need the support of everyone in the society. And again, I want to say that we are very confident that we can continue to protect our people. Thank you.
At The Cable, we know being local means supporting our own, and our customers deserve the best. Our customers deserve platinum. So now, all customers of The Cable qualify for our new Platinum Loyalty Card. An elite MasterCard experience that lets you support your own like never before. Instantly send money to any Platinum Loyalty member at home or around the world. Shop online or in person anywhere MasterCard is accepted. No interest and 0 annual fees. And the best part? If you're a Cable customer, you are already pre-approved. Just visit the or sign up online at www.thecable.net. Get your Platinum Loyalty Card today because you deserve platinum. Terms and conditions apply.
Maybe it's the way the brilliant gold liquid reflects our sunshine, or how the bright blue of its label mirrors the clear Caribbean skies overhead. Maybe it's the fresh, crisp taste of this beastly cold beer on a scorching hot day. Maybe it's even the way it brings us all together. But one thing is for sure. Carib is very much a part of who we are wherever we're from in the Caribbean. Carib. It's the way we play. Drink responsibly.
Are you wondering what to do this holiday season? Will it be the same? Will you be able to give your family all that they need? Well, with TDC Financial Services, all your holiday woes will disappear. You can get $35,000 unsecured for your holiday needs. Give us a call at 465-6516 or 469-5430 to find out how we can help to make your holidays happier for you and your family. TDC Financial Services, where money is made easy.
People make the world go round.
Welcome back to Inside the News right here on WINN FM 98.9. Yes, I'm Devon Cornelius and I'm here with Devon Brown.
Hi.
And that was Attorney General Vincent Byron with his presentation at the Prime Minister's press conference on Thursday about the COVID-19 situation and what are some of the protocols they have in place and some of the measures they have taken since the onset, of the pandemic. But we are going to take a look at what is happening in St. Vincent and the Grenadines. I remember a few Saturdays ago, I'm not sure if you guys remember, but I had a conversation with a colleague from St. Vincent, and he stated that the fear of COVID in SVG is basically gone, or it has dwindled. It's not as scary as one would think. I'm not sure if that would be his sentiment. No. I'm not sure if that would be his sentiment. No. St. Vincent and the Grenadines, there's a, and they have seen an increase.
Yes.
In the number of cases there.
According to the numbers that I have, the total amount of confirmed cases are 450, with 110 recovered. Wow. Oh, wow. So they have the 300 cases active essentially.
That is scary.
One death.
That is very, very scary. And, as I was scrolling through the internet yesterday, I came across a clip, a statement by the Prime Minister of St. Vincent and the Grenadines,
Dr. Ralph Gonzalez.
Dr. Ralph Gonzalez. I want you to open your ears and listen to this clip by the Prime Minister of St. Vincent and the Grenadines. These are his words. In me, so. Listen to this.
I see a number of people, for instance, walking about the place with gloves. I hope nobody come to me to shake my hand with gloves, because that's foolishness. And if you don't have the virus, there's no need for you to put on a mask, because putting on the mask when you don't have to put it on can do you even harm.
People make the world go round.
At The Cable, we know being local means supporting our own, and our customers deserve the best. Our customers deserve platinum. So now, all customers of The Cable qualify for our new Platinum Loyalty Card. An elite MasterCard experience that lets you support your own like never before. Instantly send money to any Platinum Loyalty member at home or around the world. Shop online or in person anywhere MasterCard is accepted. Save with no interest and 0 annual fees. And the best part? If you're a Cable customer, you are already pre-approved. Just visit the Cable building in Basse-Terre or sign up online at www.thecable.net. Get your Platinum Loyalty Card today, because you deserve platinum. Terms and conditions apply.
Maybe it's the way the brilliant gold liquid reflects or sunshine, or how the bright blue of its label mirrors the clear Caribbean skies overhead. Maybe it's the fresh, crisp taste of this beastly cold beer on a scorching hot day. Maybe it's even the way it brings us all together. But one thing is for sure, Carib is very much a part of who we are wherever we're from in the Caribbean. Carib, it's the way we play. Drink responsibly.
Honey, I have so much to do. And now I need to go to TDC Home and Building Depot to buy the new fridge.
Samantha, stop worrying. You can purchase the fridge and whatever else you may need with TDC Home and Building Depot's curbside and delivery service.
Really?
Just send your request via WhatsApp or email, pay online, and get your purchase by pickup or delivery.
Wow! I'm going to try TDC curbside and delivery service now.
Terms and conditions apply. Check our social media pages for all the details.
People make the world go round.
You were just listening to the Prime Minister of St. Vincent and the Grenadines, Dr. Ralph Gonsalves, and he said, if you ain't have the virus, there's no need for you to wear a mask. I can't get my head wrapped around that. I don't even understand. What I don't understand. Kevin, do you understand that?
No, I don't understand how a leader.
We have.
Let's
take this
take this call.
Good morning, caller. You are listening to Insider News.
Yeah, very pleasant morning to you, sir, and to your panel and listeners everywhere. I want to ask a question with respect to the vaccines that we are hearing about being touted around the United States and other parts of the world. You see, my question is, and it's based on information that has come out of the U.S. after certain people were vaccinated. We have heard of the demise of some of the people who have been vaccinated. We have heard that some of the persons who have taken the vaccines, they have perished, they have died. So that in itself would leave a lot of doubt, and it would leave a lot of apprehension amongst people throughout the U.S. and around the world as to whether it is safe to take this vaccine. So that is my trillion-dollar question. How are we to be assured / guaranteed that this vaccine is safe? I mean, what sort of proof do they have that this vaccine is anti-COVID? It is anti the so-called pandemic, which I call a pandemic, and would make it safe for persons receiving this vaccine throughout the U.S. and in other parts of the world. That is my question. So I really and truly, don't think that anyone should be coerced, anyone should be forced to take this vaccine. I think that should be a matter of personal choice. It really and truly should be a matter of individual choice on the part of each and every individual everywhere. So I know it's coming up close to midday. I would listen off the air for your response, and I would try to get back in after lunch. God bless.
Thank you very much, caller, for your question and comments on the situation. And as I was mentioning before in earlier conversation, we were talking about herd immunity, and that's another aspect of herd immunity that we're having that is going to prove difficult, because there are plenty of people in the world who do not trust the vaccines, who are very much anti-vaxxers, essentially, and they've been anti-vaxxers since before the COVID-19 vaccines. Some parents in the United States of America refuse to get their children vaccinated because they're anti-vaxxers. So that is another challenge in and of itself towards this concept of herd immunity for the entirety of the globe. And as he said, certain governments have indicated that it will be mandated for persons to get vaccinated. Airlines have basically, there were some reports that airlines will be imposing documentation that needs to be shown that said you got vaccinated before you're allowed to fly. Several reports have come out in that regard, so that is another challenge that we have concerning getting rid of this COVID-19 situation. Now, moving back to the Ralph Gonzalez situation.
As we wrap up,
yes, as we wrap up, I cannot believe a Caribbean leader, a prime minister, said those sentiments.
I can't even call it a laughing matter, but he made this statement and it was shared on Facebook. Some of the comments are crazy. One of the comments says, and I'm quoting, "That's when you have someone running a country for too long. They feel they own the people and can say and do anything." Well, I think that's getting to the political side of it. But very interesting comment. But that comment was very reckless.
Well, I'm looking at our stream right now, and there is a comment from one Mr. Roberts, and he said the clip is old, back when not much was known about the virus, when there were mixed views about wearing masks, and mentioned that even Dr. Fucci held that view. And apparently Dr. Gonzalez probably corrected himself last week, his updated advice from last week.
Right.
So if that is the case, then we're going to definitely look for that advice from Dr. Gonzalez so that we can help him.
Yes. And thank you so much, Evan Roberts, for that. We will definitely add that clip. But it does not overshadow, or it does not say that the fact that it was said.
It was said.
It was said.
It was said by a leader, considering even in those early stages, it was seen as a pandemic. It was kind of, I don't want to use too harsh language, but it seemed a bit irresponsible for a leader, even in early stages of such a situation, to say that he won't be shaking anyone's hands who's wearing gloves, or you don't need to wear the mask if you don't have the COVID-19 vaccine, even when it became known that persons were asymptomatic, so they wouldn't show signs of having the virus, and that situation is still very much prevalent. And we've also been made aware that even when you take the vaccine, even after you've been vaccinated, you can still carry the virus and infect other people, even though it wouldn't affect you. So hopefully we can find that clip and we can come back after the midday headline news.
Definitely.
And see what Dr. Gonzalez had to say in his updated advice. But thank you so much for listening to the first hour of Inside the News today. Thank you to all our callers, and we will be back.
Found the sound. 98.9 WINN FM.
We now bring you the WINN FM Headline News. The WINN FM Headline News is brought to you by Caribbean Alliance, KDP Enterprises, The Grange, Carib Brewery, CNC Trading.
Maybe it's the way the brilliant gold liquid reflects our sunshine, or how the bright blue of its label mirrors the clear Caribbean skies overhead. Maybe it's the fresh, crisp taste of this beastly cold beer on a scorching hot day. Maybe it's even the way it brings us all together. But one thing is for sure, Carib is very much a part of who we are wherever we're from in the Caribbean. Carib. It's the way we play. Drink responsibly.
Did you know Grange Healthcare Facility is the first purpose-built non-governmental healthcare organization on St Kitts, offering 24-hour nursing, therapeutic, and residential care for older adults. It's situated at Otley, 7 miles east of Vastair in beautifully landscaped surroundings. The Grange has a team of highly trained professionals provides care that's rated as being comparable with UK and North American standards. The Grange offers varied accommodation to suit your individual needs, and our all-inclusive packages make the cost of care per hour the most competitive on the island. Services include constant care for all ages, daycare facilities for older adults, rehabilitation services, and training and continuing education for healthcare providers. For more information, call 466-5525 or 465-8020, fax 46-8221, or email thegrangehealth@gmail.com, or visit our website at www.grangehealthcarefacility.com.
We are faced with tough decisions every day, but choosing the right home or motor insurance shouldn't be one. You need fast claim settlement from a company that's been rooted for over 31 years. And don't forget the A Excellent rating by AM Best. Make the intelligent choice. Caribbean Alliance Insurance. Reliable insurance that you can count on. Get a quote today for your home, motor, contents, and liability insurance needs, and make the intelligent choice. Caribbean Alliance. Tomorrow secured. Local agents, Dalil Walwyn & Co. Limited. Telephone 465-2631 or 469-5303 for the Nevis office.
With 39 million infections across the Americas and almost 1 million killed by the coronavirus, PAHO Dr. Carissa Etienne is warning that global trends suggest that infections are on the rise.
Virtually every country in the Americas is seeing an acceleration in the virus's spread. In North America, the United States is reporting the highest new COVID-19 infections and deaths in our region. California and states across the American South have seen dramatic increases in COVID hospitalizations, with 13 states reporting record-breaking figures. Today, more than 132,000 are hospitalized from COVID-19 in the United States. These are more hospitalizations than during the pandemic peaks in the spring and the summer. These trends in hospitalizations are also being reported in Canada and Mexico, where the local health systems are struggling to keep up with demanding care.
The numbers are rising in the Caribbean and South America.
Across the Caribbean, data from early January reveals that many islands saw rapid rises in infections. The Cayman Islands, Dominica, and the Virgin Islands reported a doubling of cases within the last week alone. And cases are growing even more rapidly in Barbados, St. Vincent and the Grenadines, and Bonaire. And as we move to South America, every country has reported a rise in cases over the last few weeks, even in countries that had seen a decline in cases, like Chile and Argentina.
New variants of the virus are spreading faster, and while vaccinations have started in some Caribbean countries, Dr. Etienne warned that limited vaccinations will not contain the virus.
With the arrival of vaccines, we must ensure not just that doses are produced quickly, but they are equitably delivered and swiftly across every country, regardless of income. This will require global and regional collaboration and solidarity, with donors pitching in resources through mechanisms like the COVAX facility. Second, we need leaders to act quickly and foster unity. This pandemic has taught us time and time again that leadership determines the effectiveness of a country's response. As we look to the year ahead, leaders will face difficult choices as we work to flatten the transmission curve. And that's why we need leaders to act transparently so that the public understands their decisions and the scientific evidence that is behind those decisions, so we can rally people around a shared plan. We need leaders to act in the interest of public health, not political gain, by working together to make the best use of the tools to prevent this virus. Politicizing vaccines and other control measures is not just unhelpful, but it could fuel the virus and cost lives. And finally, we must balance urgency with good planning. We don't have much time to lose, but we cannot beat the pandemic without strong vaccine delivery plans.
Justice cannot be quarantined, says Chief Justice of the Eastern Caribbean Supreme Court, Dame Justice Pereira, while reporting on the work of the court in 2020.
While the buzzword in the management of COVID is quarantine, as judicial officers at whatever level, the realization quickly penetrates our consciousness that justice cannot be quarantined. Crises do not suspend or end conflicts. They simply give rise to new ones. In advancing our commitment to the improvement of the administration of justice and our quest to build resilience for coping with life-changing events, it is first necessary to take stock of where we are now.
Dame Pereira reported on the number of cases heard last year.
At the Court of Appeal, there were 481 appeals filed in 2019. The court heard 393 appeal matters in full court sittings and a further 456 matters in chamber hearings. The Court of Appeal delivered 55 written judgments and 348 oral decisions, amounting to 403 decisions delivered in total. This is by no means insignificant, given the relatively small size of our appellate bench. Fortunately, in June 2020, we were able to increase our complement to 7. At the High Court level, throughout the court's jurisdiction, a total of 7,450 cases were filed and 4,384 were disposed. Antigua and Barbuda and St. Lucia remain the states with the highest caseload by number.
The backlog is due to a number of factors, the Chief Justice said.
Furthermore, on average, the overall clearance rate of member states and territories as a grouping continuously declined over the last 3 years and was at its lowest at 59% in 2019. This flags a dire need for continued and more robust measures to be implemented in those member states and territories which are falling behind. It requires an all-hands-on-deck approach by all stakeholders to arrest and reverse this trend. The factors impacting this trend are many, but in large measure reflect the persistent shortcomings of physical, human, and financial resources at their core. A comprehensive report on the working of the court can be found in our annual report, which will be available on the court's website.
Last year, the coronavirus pandemic added additional pressure on the judicial environment, and the Chief Justice is recommending judge-only trials to expedite matters.
In several of our member states and territories, the pandemic grounded the conduct of jury trials, due mostly to our inability to provide the required proper physical distancing protocols in many of our existing courtrooms. The simple truth is that many of our courtrooms are too small, and in some cases not enough. In the COVID-19 environment, it is impossible to have jurors sit elbow to elbow. The question then becomes, what is the solution to this dilemma? In my view, the time is ripe for all governments, in consultation with civil society, to engage in discussions on the implementation of judge-alone criminal trials for specific case types within the context and framework of the constitutional mandate of fair trials within a reasonable time. Judge-alone trials are not new in our region. This move has enjoyed much success in reducing case backlogs in the neighboring state of Trinidad and Tobago, as well as in Belize. It is also being practiced in the Cayman Islands and the Turks and Caicos Islands. I have no doubt that in this COVID climate in particular, the implementation of judge-alone criminal trials would go a long way in reducing the backlog of criminal cases in the Eastern Caribbean, with no impact whatsoever on the fairness of such trials.
The deaths of Customs Officer Andrew Douglas and Stoneford Heights resident Sandra Adams have been ruled as suicides. 21-year-old Douglas was found dead with a single gunshot wound to the head on September 17, 2020 at the Customs Department in Burn Rock. 59-year-old Adams was found dead at her home on September 26, 2020. Police say on arrival she was found unresponsive with a cord wrapped around her neck. Commissioner of Police Hilroy Brandy responded to a question from WINN at Thursday's press conference hosted by Prime Minister Dr. Timothy Harris.
In answering the question put by the journalist, I will first go to the lady at Halfway Tree that was reported found in her house with injury about her body. A postmortem was performed by our resident pathologist and come to the conclusion that those injury was self-inflicted. Also, a postmortem was performed by the resident pathologist and his conclusion that that injury was self-inflicted. As a result, these files are pending before the magistrate court for a coroner's inquest, as speculated by the law that you have to do a coroner's inquest to conclude these matters.
The commissioner also confirmed that 3 citizens of St Kitts are still missing.
Concerning the 3 missing persons, one from Cayman, who were last seen at Kim Collins, the other from the Basti area, the student from Clarence Fitzroy College, and the other was from Connery, the elderly gentleman. Those matters are still under investigation, and as information come forward, the police continue to investigate, and we are appealing to the general public. If you have any information, and like the Prime Minister said earlier, if you see something, you hear something, say something, and we will investigate.
21-year-old Shalvin Marks of Virchilds was last seen leaving home in December 2019. 81-year-old David Lake of Connery was last seen by his caretaker at about 5 p.m. on August 16, 2020. 36-year-old Jabal Henry of Upper Keon was last seen on January 31, 2020, walking along the Kim Collins Highway. St Kitts and Nevis Citizenship by Investment Program (CBI), established in 1984, is a major economic driver and has at times contributed close to 35% of the Federation's revenues, according to media reports. WINN has sought confirmation of the exact revenue generated by the CBI over the past 5 years.
Questioner asks for the figures over the last 5 years, subject to say that these are already in the public domain, and one will just have to refresh with respect to these.
To the question for the nationalities of the people who are attaining citizenship through the CBI, Dr. Harris replied that there was a wide range of interest in the program and that's why it's a platinum brand that attracts people from all walks of life.
The persons who come to the program or who become citizens, they hail from a variety of other countries. The United States of America, we have citizens of Canada, we have citizens from Russia, we have citizens from China, almost all across every area of the globe. The program has found attraction. The Middle East, Africa, etc., we have them. And so even when we look into our local domain, we see a number of businesses coming and stream by Chinese. The principles behind them are all, for example, citizens of St Kitts and Nevis.
Citizens from Iran and North Korea are barred from CBI.
Principal person behind, for example, the Galaxy Hotel is a citizen of St Kitts and Nevis. We have them involved in supermarkets, in restaurants, etc., etc. Just perhaps last week, we had the grand opening of Land's Kitchen restaurant in Frigate Bay, a new upscale cuisine being added to the menu of services offerings here in St Kitts and Nevis.
Prime Minister of St Kitts and Nevis and Minister of Finance, the Honorable Dr. Timothy Harris.
Live from NPR News, I'm Giles Snyder. President-elect Joe Biden is laying out the details of his plan to speed up vaccine distribution as the U.S. nears 400,000 deaths from the coronavirus. NPR's Windsor Johnston reports on Biden's plan after he called the rollout under the Trump administration a dismal failure.
Biden is pledging to correct course and meet the goal for distributing 100 million shots in his administration's first 100 days.
We will immediately work with states to open up vaccinations to more priority groups. The process of establishing priority groups is driven by science, but the problem is the implementation has been too rigid and confusing.
Biden said he'll use the Defense Production Act to increase the supply of vaccines. His plan also includes the creation of vaccination centers across the country and mobile clinics to reach underserved urban communities and rural areas. Windsor Johnston, NPR News.
California and other states, including Wisconsin, Illinois, and Michigan, are working to avoid what happened at the U.S. Capitol last week. They're beefing up security ahead of Joe Biden's inauguration on Wednesday. Demonstrations are expected to begin this weekend. In Florida, prosecutors say a man has been charged with trying to organize an armed response to pro-Trump protesters expected at the state capitol in Tallahassee tomorrow. Before Senators-elect John Ossoff and Raphael Warnock can be sworn into the U.S. Senate, Georgia must certify the results of the January 5th runoff elections. From member station WABE in Atlanta, Christopher Alston reports.
Today is the deadline for election officials in Georgia's 159 counties to certify the results of the state's 2 Senate races last week. All except a few dozen counties had completed their certification as of Thursday afternoon. Georgia's Secretary of State's office will review the certifications after the Martin Luther King Jr. holiday weekend. They must certify results for the state by next Friday, January 22nd. Once the Secretary of State certifies, the results are to be confirmed by the governor, then delivered to the U.S. Senate. Georgia must complete its certification process before Democrats can establish a majority in the Senate. For NPR News, I'm Christopher Alston in Atlanta.
The party of German Chancellor Angela Merkel has elected a new leader. Pro-business politician Armin Laschet offers a clear continuation of Merkel's policies. And as NPR's Rob Schmitz reports, he's now one of the top contenders to replace Merkel as chancellor.
For more than 3 years, Armin Laschet has served as the premier of North Rhine-Westphalia, Germany's most populated state. As a politician, the 60-year-old Laschet has been a close ally of Chancellor Angela Merkel, and his candidate for chairman of the Christian Democratic Union Party offered a clear continuation of her policies. As chairman of the CDU, Laschet is now one of the top contenders to replace Angela Merkel as chancellor at the end of this year.
And you're listening to NPR News. India launched what it's calling the biggest vaccination campaign in the world. The first dose is being administered today, as NPR's Lauren Freyer reports from Mumbai.
The first Indians to be vaccinated today were nurses and other frontline healthcare workers, including this one, Namika Kumari, in the eastern state of Bihar. I feel fine, she says, encouraging everyone to follow suit. India has approved 2 formulas, the Oxford AstraZeneca vaccine and another from an Indian company called Bharat Biotech. The latter is still in phase 3 clinical trials, and some scientists and public health experts say it was rushed out too quickly. Recipients do not get to choose which one they receive. India aims to vaccinate 300 million people by July, but it could take 2 years to vaccinate all nearly 1.4 billion Indians. Lauren Freyer, NPR News, Mumbai.
That was the WINN FM headline news, brought to you by KDP Enterprises, Caribbean Alliance, Carib Brewery, CNC Trading, The Grange.
We're faced with tough decisions every day, but choosing the right home or motor insurance shouldn't be one. You need fast claim settlement from a company that's been rooted for over 31 years. And don't forget the A Excellent rating by AM Best. Make the intelligent choice. Caribbean Alliance Insurance. Reliable insurance that you can count on. Get a quote today for your home, motor, contents, and liability insurance needs. Make the intelligent choice. Caribbean Alliance. Tomorrow secured. Local agents. Dalil Walwyn & Co. Limited. Telephone 465-2631 or 469-5303 for the Nevis office.
Did you know that the Grange Healthcare Facility is the first purpose-built non-governmental healthcare organization on St Kitts, offering 24-hour nursing, therapeutic, and residential care for older adults? It's situated at Otley, 7 miles in beautifully landscaped surroundings. Grange is a team of highly trained professionals and provides care that's rated as being comparable with UK and North American standards. The Grange offers varied accommodation to suit your individual needs, and our all-inclusive packages make the cost of care per hour the most competitive on the island. Services include convalescent care for all ages, daycare facilities for older adults, rehabilitation services, and training and continuing education for healthcare providers. For more information, call 466-5525 or 465-8020, fax 466-8221, or email thegrangehealth@gmail.com. or visit our website at www.grangehealthcarefacility.com.
Maybe it's the way the brilliant gold liquid reflects our sunshine, or how the bright blue of its label mirrors the clear Caribbean skies overhead. Maybe it's the fresh, crisp taste of this beastly cold beer on a scorching hot day. Maybe it's even the way it brings us all together. But one thing is for sure, Carib is very much a part of who we are wherever we're from in the Caribbean. Carib, it's the way we play. Drink responsibly.
We're different. We're 98.9. 98.9. WINN FM.
People make the world go
Cable, we know being local means supporting our own, and our customers deserve the best. Our customers deserve platinum. So now, all customers of the cable qualify for our new platinum loyalty card. an elite MasterCard experience that lets you support your own like never before. Instantly send money to any Platinum Loyalty member at home or around the world. Shop online or in person anywhere MasterCard is accepted. Save with no interest and 0 annual fees. And the best part? If you're a cable customer, you are already pre-approved. Just visit the cable building in Bastere or sign up online at www.thecable.net. Get your Platinum Loyalty card today because you deserve Platinum. Terms and conditions apply.
Gift for Dad's birthday? Click. Ooh, Janice's retirement party? Click. Outfit for my girl's wedding? Click.
With TDC Airbox, you click, we ship. Register for your free U.S. mailbox today and shop all your favorite stores online. Enjoy the convenience. Free consolidation up to £10. Competitive rates. Free package tracking account with live notifications. Free delivery and, of course, excellent customer service. Visit our website at tdcairbox.com and register today. For more information, visit our offices at the C.A. Paul Industrial Site in St. Kitts and Penny's Industrial Site in Nevis. Follow us on social media at TDC Airbox. TDC Airbox. You click, we ship. Terms and conditions apply.
Maybe it's the way the brilliant gold liquid reflects our sunshine, or how the bright blue of its label mirrors the clear Caribbean skies overhead. Maybe it's the fresh, crisp taste of this beastly cold beer on a scorching hot day. Maybe it's even the way it brings us all together. But one thing is for sure, Carib is very much a part of who we are wherever we're from in the Caribbean. Carib. It's the way we play. Drink responsibly.
People make the world go
see a number of people, for instance, walking about the place with gloves. I hope nobody come to me to shake my hand with gloves, because that's foolishness. And if you don't have the virus, there's no need for you to put on a mask, because putting on the mask when you don't have to put it on can do you even harm.
According to the Caribbean Media Corporation, CMC, most businesses in St. Vincent and the Grenadines say it would be helpful. And this is an article from the 13th. So as of January 13th, 2021, most businesses in St. Vincent and the Grenadines say it would be helpful to their operations in the current COVID-19 environment if the wearing of masks, face masks, that is, in public places was made mandatory, the Chamber of Industry and Commerce has said. However, Prime Minister Dr. Ralph Gonsalves has indicated that his government would prefer to use persuasion and public education to encourage persons to adopt the practice. This is as of January 13, 2021. Calling in on local radio program Issue at Hand, where he spoke about the impact of the pandemic on the private sector, the executive director of the Chamber of Industry and Commerce in St. Vincent and the Grenadines, Tony Regisford, said a mandatory order could assist, although he acknowledged there was no guarantee people would fall into line. This is as of January 13, 2021. I remember having a conversation with a colleague from St. Vincent I think it was probably more than 2 weeks ago or 3 weeks ago, where he's saying that they don't really have to, it's not mandatory for them to wear masks in St. Vincent and the Grenadines. Some businesses are saying in order for you to come inside, you have to have a mask. However, most business places, you just walk in, no mask. I guess you hand sanitize, but you don't have to wear a mask.
Well, as indicated by one of our viewers on our Facebook live stream, he indicated that the video was old, and instructed that Mr. Gonzalez, he spoke on NBC Radio St. Vincent and the Grenadines about the current response to the virus, and he was making those comments on the 13th of January. That would have been on Wednesday, and we have that video to play right now.
Now, I just want to say to everybody, try and go easy on the rumors. Some of them is mischief making and malicious. Some of them is just people like to pass information on, which to find out things because they hear it and it's multiplied. For instance, I am told that I had COVID and that I was in quarantine. Well, if I'm tested positive for COVID, I will tell the country straight up that I'm tested positive for COVID. There's nothing, there is no nothing immoral. There's nothing which is a stigma attached to getting COVID. Anybody can get it. Anybody can get it, and you're going about your business normally and you take precautions and you can get it. But you're less likely to get it if you take certain precautions. All of us, that is. The truth of the matter is that there's only one person in the cabinet, which has been known already, but tested positive. And that was that person before they attended, several days before they attended a cabinet meeting. That it shows where they got it, and they didn't come to that cabinet meeting subsequent to when they contracted it. The person's quite healthy. Nothing untoward. They also said, somebody texted me that yesterday, lady texted me, a school teacher. I can read it. Prime Minister, are you okay? I'm hearing that you had a heart attack. Please tell me it's not true. No, I don't have a heart attack. Never had a heart attack. They also said that Montgomery was on his deathbed with a heart attack. So also I think Montgomery Daniel was hospitalized yesterday in Georgetown. Naturally, if you're 66 years old and you're in the business in which we are, they'll check you for everything, including to see what's happening to your heart. I can report, even though he doesn't give him permission to say it, because the doctor told me that, the inquiry into the heart, it's fine. Last week, both on the rapid and the PCR last week, Wednesday, he tested negative for COVID because body got tested. He got tested again in the hospital yesterday for COVID is negative, people do get sick, you know. So, I mean, you know, just ease up on these set of rumors now. So I'm just, I mean, I don't like necessarily to be talking about these things, but to the extent that these things going about and causing some people some anxieties.
That was Prime Minister of St. Vincent and the Grenadines, Dr. Ralph Gonsalves, with his statement after the previous statement regarding the masks. But as I said earlier, based on reports, media reports, before we continue, let's take this call. Good afternoon, caller, you're live.
Greetings.
Greetings.
Yes, good afternoon.
Yeah, sorry about the feedback just now. I didn't want to miss a word you're saying. Well, concerning the Honorable Prime Minister of St. Vincent, I find nothing, you know, funny in what he said in both utterances. I mean, he said it straight up. He ain't shaking nobody hand in the blouse. And he said straight up, if you don't have the corona, there's no need to be in a mask. If you're around people who have it, you know how to, you don't know they have it, so you just take precaution. You don't have to be in a mask.
But how do you know a person have it? Do we have visual indicators to let us know when a person has COVID?
No, but listen to me, man. Listen to me. There is certain procedure going on with ones and ones who move from one area to the next, one place to the next. And if that procedure go right, then the conglomeration of people, because right now people are mix and mingle and party and nobody got a mask, because people feel assured that who they're mixing and mingling with is okay. That's a go on. So what we do? Stop mix and mingle? And just go about like this little scary thing. No, we can't live so, you know. Yes, we are in the midst of whatever we are in the midst of. But we have to free up ourselves. That means I say, me no wear a mask, you know. Unless me go in place where we say you have to come in with the mask. All me do well when me see crowd of people, me no mix and mingle between crowd of people, and me just keep my immune system up. Me don't see nothing funny. Nobody have to say, well, that's when people lead in power too long. No. The man is just freeing up himself. The man say him not shake somebody hand in gloves. And if you don't have the corona, there's no need for you to walk around with mask like mask man. Nothing wrong with that. And please don't me no want nobody attack the man and jump on the man, because the man is a leader and what? He's a human just like us. That's how the man feels. That's his personal vibes. You should just accept it. Our honorable Prime Minister here, me see him on certain occasion, me talk, on certain occasion he put on mask. It's just his vibes. He do it according to how we feel and according to, I just saw the thing said. Me no feel like nobody will take it, make no big hullabaloo about the man. And see come on and say, blah, blah, anybody can catch it. He can't just go on. But just that he, within that moment, he just free up himself and say, well, nobody will shake him hand in the blouse. Simple. Anyhow, we not take up no more your time. We continue to listen. Good program. Blessed love.
Thank you so much, caller. Thank you so much for your input. But let me just add, I wouldn't say anybody is attacking the Prime Minister. The fact of the matter is that it was said, not by me, not by Kevon, not by you, but by him. If you are in a public setting, the only wise thing to do is to wear a mask. I don't know if Kevon has COVID. I don't know if another colleague has COVID.
Right.
So you two things: you wear a mask or you socially distance yourself.
And when he was talking about freeing up yourself, there are plenty of countries out there that decided to free up themselves a little bit. They decided to get a bit laxed in their procedures, and now they're having to tighten up.
Kevin, if I may add, look at Barbados. I have some colleagues in Barbados who I would follow on WhatsApp, and I would see them on their snap, living regular, operating as if nothing is wrong. Nothing named COVID. That is how they were operating. And they were saying, oh, the protocol's too strict. The protocol's too strict. Let's follow Barbados' protocols. Now, I'm not talking down on Barbados, so please don't get me wrong. I'm not talking down on Barbados. But the moment we say we're going to ease up the protocols, you never know what could happen. I mean, don't get me wrong. Even with the protocols being strict now, anything could happen.
However, the risk considerably grows if we decide to ease up on protocols.
It fluctuates. It goes literally through the roof.
Yeah, considering the pattern of the plenty of examples that we've had globally, where countries were doing fine. I think New Zealand was a prime example. They had absolutely no cases at the start of this pandemic, and then they eased up on their protocols and they opened their borders, and then bam.
So that is the reality. That is the reality. But people always say, oh, I ain't have no COVID, so I ain't wearing a mask. It's like when I'm in Nevis and I'm going to the grocery store or in the bank or whatever. People literally putting up a fight to say, I don't have COVID, so I'm not going to wear any mask. Do you have COVID? These are some of the comments that have been thrown around. And I'm there standing, I'm like, how do you know that the security guard doesn't have any COVID? How do you know that you don't have COVID? How do you know that? I was listening to a clip, Kevin, that stated that you could contract the virus today, the 16th day of January, and 2 weeks later you find out you got COVID. 2 weeks later. So 2 weeks you went to the bank, you ain't got on a mask. You went to the store, you didn't have on a mask.
You went home.
You went home with your family, with toddlers. You're not following the protocols. So two things: you either wear your mask or you practice social distancing. Do not be up in nobody's face. So I think the comment by the Prime Minister was reckless. And I'm not going to apologize for saying it. I think it was reckless. And nobody's attacking the Prime Minister. He is the Prime Minister. And scrutiny is expected. But let's take this call. Good afternoon, caller. You are on Inside the News.
Hey, good afternoon, Evan and Devon.
Good afternoon.
That was not only reckless, it was irresponsible. And you see where he is now, in the hospital. And rumors going on that he has COVID and heart attack and all of those. You see, when you're in certain position, you will have some time to subdue your personal thing for the general good. Because he's a person of influence. If everybody decide, well, the Prime Minister say you don't have to. What is the status of the COVID spread?
I think they know, as of yesterday, they recorded 62 new cases and 1 death. 62 new cases and 1 death.
I wonder if he has any sense of responsibility. It reminds me of President Trump,
Ooh, some people
when I heard him, he's echoing what President Trump said and did. And some of us are so we don't even think for ourselves. He don't want to be weird. He just keep far from you. But he must understand that all political leaders, church leaders, leaders of organization, you have influence over other people who take what you say seriously.
Yes. Precisely.
So it doesn't matter how you feel or how you don't feel. Keep your feeling to yourself. When you're in certain position, keep your feeling to yourself.
Miss Henry, I'm getting reports that Prime Minister Dr. Gonzalez is not in the hospital, and actually I think he addressed that because that was a rumor that was going on in the video that we were playing previously. He is not in the hospital. Well, I'm not certain about
I'm not certain
about his personal health issues.
That video you played. That people were saying he had all kind of thing, but
he did say that someone.
He was tested twice for COVID.
Yeah, he did say that someone reached out to him to ask him if he was in
he
the
had a heart
hospital.
attack
He said it wasn't true.
I think he said the doctor tested his heart. Maybe I don't know if it's routine, if you want to call it routine. He was tested twice, which made that they suspected he had it. You know, so I am calling upon our people to act rationally. You may not get it. My daughter in the lab said Trump had 3-day corona. 3-day corona. But by the time he had the 3-day corona, there were so many persons in the White House who went to his function who ended up positive. Some of them were seriously ill. He has called on rallies, have people out in the cold weather, no mask, no nothing. Irresponsible behavior, and it needs condemning. So my good family, don't make no sense to say don't condemn him. His behavior was reckless and irresponsible.
Yeah.
All right then.
Thank you for your input. Kevin, have anything to add?
No, I think we said a mouthful on that situation, and I don't want it to seem like we're attacking. I don't want it to seem like we're attacking Mr. We already agree that those comments were irresponsible, regardless of the time that they were made, because apparently they were made earlier when there wasn't much information about it. However, regardless of the timing, considering the fact that it was a pandemic, considering that it was a pandemic, we knew it was a pandemic earlier in the year. At around January, February, there were talks that it was a global situation. So regardless of how early he said those statements, they were still irresponsible. They were still reckless, which is, it's the truth.
Yeah, it's the truth. And just to add to what Kevin said, or piggyback off of what he said, that is the gospel truth. That is the gospel truth. We have another call. Good afternoon, caller. You are on Inside the News.
Greetings.
Look, why we don't keep the personal feeling to ourselves? Leaders not different. Watch out. Leaders come out of we. The leaders come from amongst we, come from we, are the same people. When the man go on like in a human, like in a part of we. We don't express ourselves. We don't keep nothing to ourselves. We express ourselves. See, the family just express yourself. The man expressing himself. Put aside leadership thing, and you compare the man with Donald Trump. Don't do it at all. A different matter, different people. Gonzalez is a conscious man. The man say what him say, and it's just so it go. Him not tell nobody what to do. Him not talk about how him flex, how him see it. We not talk how we see things. Only in the studio not talk how we see it. We don't say reckless and irresponsible. Family don't just call it, only expressing on yourself. And we don't have a right to do so. We don't have a right to differ to the man's opinion. But do not say the man don't have a right to his opinion and what do you mean? He don't express it. And he express after that how he feel. The man having every human being on the earth is on their level. Every human, whether you're a leader or you're a follower or servant or whatever, are the same human being. And everyone have their level of meditation. The man speaking from his meditation. when he gets up and went to Ethiopia with 7 or 8 Rastafari virgins. You see any other Caribbean leader do that? That's his meditation. When he say, when he asks them to that visa not required for people coming to the continent of Africa from St. Vincent, that's his meditation. The man doing things according to his meditation. That is Ras Gonzal's meditation. You know, stop trying to dictate the man meditation. Because I want dictating on the one. Blessed love.
Thank you, caller, so much for your input. You're listening to Inside the News right here on WINN FM 98.9. We are still taking calls. You can call us at 466-0989, 762-0989, and 662-0989. And we are also taking your question and queries, your comments, your concerns via WhatsApp at 662-2204. The number again, 662-2204. Let's take this call. Good afternoon, caller. You are live.
Yes, good afternoon.
Yes, good afternoon, caller.
Yeah, my brother Eli, Gonzal got the right to his opinion, but as a leader, leaders must know what they're telling we. We ain't animals. You understand? I think that Gonzal, what he said, ain't got no values, and we shouldn't hold on them kind of things from leaders. We're in a pandemic where you're telling these poor black people in Wayne, just forget about the protocols. Come on, Eli. We better than that. These politicians must think what they're saying to people. We're an animal. Don't need the abattoir. We black people across the Caribbean, and we're stupid. What he said, he carry weight around the islands. You see what's going on in these black people around here, these young boys? No kind of respect. You see what you're doing up there? By the taxi stand to go up, by the bus stand to go up Mount Hill, and people coming and disrespecting you? Because I'll come better than that. If you're hearing me, Ralph. And if I the man have to see in person, you're going to get it yourself. Them kind of statements have no value here. In the Caribbean, we're going to accept them kind of things. This is a protocol, and you all as leaders got to respect we. We ain't animal. Watch what you're saying, my brother. Words is very powerful. Have a good day, Kevin.
Thank you, caller, for your contribution. This is a very hot button issue.
Yes.
Yes, we have very differing opinions. And
I like that.
Yes, it breeds, I think, necessary discourse among the community when people with differing opinions can come together and have a conversation and express their views on how they feel. And looking at our Facebook, there is a comment, again, from Mr. Roberts. Mr. Roberts is feeding our comments on Facebook. We appreciate that. Before we take this call, Mr. Roberts said that Gonzalez was tested twice because he had to travel, and when he came back, he went into quarantine. The checking of the heart, apparently, according to him, is for another minister who is in the hospital. And I think Gonzalez in his video spoke to that. But caller, you're live on Inside the News. Good afternoon.
Hi, very pleasant afternoon to you and your panel again, as well as all your listeners. With respect to the following of the protocol, right? I personally have no problem with following protocol, but I think we also have to bear in mind that our health is of utmost importance. Our health is quite significant to all of us. And when you have people wearing masks day in, day out, night in, night out, I see this as total nonsense. I personally do not like to wear masks. I do not think that anybody should be wearing any mask. That is my personal view. So I quite agree with Gonzalez. I agree with him 100%, 100% plus. We live in an area of the world where we are islands. We are small islands surrounded by water and fresh air. our islands and our towns and cities are not like Mexico City, where our towns and cities are congested with massive amounts of people, huge, large amounts of people. We live in small islands, and our environment, our climate, is far different from places like Rio de Janeiro, and Mexico City, and New York, and those places. Hence the reason why we have not suffered significantly from COVID-19, or this pandemic that they have put on us, as the bigger countries, the metropolitan countries, because we have much cleaner environment, a much cleaner atmosphere, much cleaner air. You know, the air that we breathe in the small Caribbean islands is a lot cleaner, a lot fresher than the larger metropolitan states, metropolitan countries of the world. So there is no need for us in the Caribbean to be wearing masks day in, day out, night in, night out. That to me makes absolutely no sense, because what we are doing in truth and in fact is that we are recycling carbon dioxide and making ourselves sick. So we do not have to do that. Absolutely nothing wrong with sanitizing hands and so forth. Nothing wrong with that. But the whole idea of inconveniencing people, if you don't have a mask, you have to go back home to find a mask. You don't have a mask, you have to go to a Chinese super rare, to a Chinese eatery or some place to spend $4, $5 to buy a mask. That to me is inconvenience. It is total inconvenience. It's making people waste time, and lose money. So there is no need for people to be, you know, look at it. We are actually going out of this COVID thing. We are going out of it. And we need to give God thanks.
Colin, you said we're doing what?
Blessed.
Sorry?
Repeat?
You said we're doing what? I didn't hear the last part.
Yeah, I'm saying that we are literally going away, moving away, going out of this COVID thing. And we need to give God thanks that we, the small islands of the Caribbean, have been blessed with limited fatalities. It's more the bigger countries of the Caribbean, places like the Dominican Republic, Jamaica, Trinidad, the bigger countries have had the fatalities. Look at the sub-region, the OECS, the islands of the Windwards and the Leewards. We have had very limited fatalities because of our climate, because of the environment in which we live, and that is obvious. People are just stretching this thing too far and amplifying it and putting pressure on people to spend money unnecessarily to buy masks and wear masks. That doesn't make sense to me. It doesn't make sense. We can observe the protocol through the sanitizing of hands, you're washing your hands, and so forth. But we need to give thanks that we haven't had a lot of fatalities in our small islands. While I am on the line with you, just indulge me a little bit to ask a question about the completion of the Island Main Road. We have seen almost the completion of the Island Main Road, including the completion, near completion of the Old Road Bay project. But what is happening to that area between Bloody Point and Conyers on the western side? You know, as bus drivers, lots of potholes, deep potholes, damaging your shocks and your front ends, your suspension and so forth. I believe the roads division of the Ministry of Infrastructure, the Ministry of Public Utilities, they need to patch these holes. We have lots of cuts on the western side, all kinds of ditches and potholes, deep potholes. They need to patch those things. If they are not in a position to complete the resurfacing of the island's main road, what they can do in the meantime, temporarily, is patch the potholes to make life more comfortable for road users. They all use the roads. The bus drivers, the private vehicles, people in a high echelon of society use the same roads, and they know the bad condition of the roads on the western side, so they need to fix those roads now. Patch the holes and make life more comfortable for people. When they're ready now to complete the resurfacing, then you do your excavation and you complete the resurfacing. But in the meantime, they can patch the holes. We have a lot of cuts. Almost everywhere you go is a cut or some ditch. the buses are falling in and landing in with loads of people, and that to me is not good enough. I think the Ministry of Infrastructure, Public Utilities, Road Division especially, they need to work on that area between Bloody Point and Conyers on the western side to make life more comfortable for road users. That's my take on this. God bless.
Thank you so much, caller, for your input. We have another call. Good afternoon, caller. You are live on Inside the News. Caller, good afternoon, Inside the News.
Good afternoon. Try as we may, it doesn't appear that we can separate politics and economics from COVID-19. I mean, which is ultimately, primarily at least, a health issue. And so decisions on the optimal percentage of populations to be vaccinated and who should be vaccinated first and the protocols and the economic responses, all these come into play. And complicating the issue is the fact that there's still lots we don't know about COVID-19. I mean, we don't know how long the immunity is going to last after vaccinations. And uncertainty like these make planning for economic recovery difficult, but all the more necessary. It was interesting to hear in the news item 12 that an expert was calling for more transparency and openness in the leadership and government, and an appeal to avoid using COVID for political purposes. We here in the Federation would do well to heed that advice, as well as the advice she gave on planning more. We have to plan more. We have been too reactive rather than proactive from the outset. It was noteworthy, too, that at this time of economic uncertainty, the meeting of the CARICOM Council of Ministers thought it fit to issue a communique in support of Guyana against Venezuela, the equitable access and distribution of COVID-19 vaccines, and the unilateral declaration of the USA, which designated Cuba as a state sponsor of terrorism. All that is fine, but I would have thought there would be laser focus on COVID and the plans for economic recovery. I think in CARICOM they call it CERT, the Caribbean Economic Recovery and Transformation Plan. I would have thought that that would be paramount. You don't keep us alive from COVID by vaccinating us. So then let us die of starvation. So the economics, just as important. I'm also wondering if we should not be more focused on trying to develop more accurate and faster and more widespread testing. By which I mean, the developers of vaccines and tests. Everybody is saying that COVID and its effects will be around for years, and that being the case, it's even more important that, even more important than a vaccine, I would think, would be the ability to determine very quickly whether you have the virus in transmissible amounts. For even if you have been vaccinated or if you've had the virus, you may still be asymptomatic or a carrier. We cannot get back to normal if we are going to have, whether it's a 14-day or a 7-day or less quarantine times. That's too disruptive and expensive. We have to do it now, but I don't know if we could continue that for very much longer. You realize that even though COVID has affected so many industries and so many people are out of work, there are also a multiplicity of industries that have been spawned and that have been helped, right? Big pharma, for instance, the big pharmaceutical countries, okay? And we need to make sure that the beneficiaries of COVID are devoid from making decisions that benefit them, right? I'm not sure that's the case now. If you produce vaccination, what why do you think they would be inclined to be just as vibrant about producing tests? What is the incentive for them? And so they might want to exploit the vaccination part of it, okay, because that's obviously worth billions of dollars, okay, before then getting into the testing. And I'm saying that maybe the testing is more critical, okay, and the people who are making these decisions on whether to focus more on the vaccinations as opposed to the testing, should be really looking at what is behind that kind of thinking. Okay.
Well, I have a counter question for you, caller. Let's say that the mindset was different. Let's say they were more focused on testing, and so they put more resources into testing. Based on the rate at which COVID-19 has spread, the testing might have been just as disruptive as, let's say, quarantining. Because if the person tests positive, they have to isolate themselves for a period of 2 weeks so that the virus could run out of their system. And if you multiply those numbers exponentially, it would still affect the economies in a negative manner, because all of those people will have to either not work or work from home, and so.
Yeah, but look at what happens now. Just in our small case, for instance, right? Everybody comes in, undergoes the 14 day quarantine, don't they? Even if they have a negative PCR test.
Correct.
3 days before, right? Everybody, without exception, right? In the end, it turns out, well, from the cases we've been having, only 1 or 2 or 3 of, I think it was just over 2,000 people came in, have tested positive and had to go into isolation. If you had a faster test, a more accurate test, then that would not be necessary. And I'm thinking I've seen cases where you have a test on the horizon that can be done in minutes and get back results in minutes. You see what I'm saying? So instead of having to quarantine everybody, you take your test, okay? It's faster and accurate, and you can be assured that it's not going to transmit the virus in the population, okay? And you go about your business. And you only those who test positive are therefore affected, and those numbers are low.
Well,
see what I'm saying?
Well, as you mentioned, I think it's a differentiation in the importance or the significance of where the resources should go. If they did put the resources into creating a more effective test, then resources for a vaccine would have been depleted, and that way the timeline would have been depleted. So it's still there's still a problem there, because the pandemic would still happen. The pandemic would still be.
Vaccine was a knee-jerk reaction to what happened. Okay, remember that we've had like SARS and so on before. It just turns out that COVID-19 is more infectious than SARS. It's not as deadly as SARS, but it is more infectious, and that is what created the panic, okay? And that is what tested. That is why I said I still think that the emphasis should have been on testing, so that once you know that people have it, you can deal with those people and let the rest of the population go about their lives as normal.
Well, you said it was a knee-jerk reaction. I don't think that the vaccine was necessarily a knee-jerk reaction. Let's take, for example, the Ebola situation. We had a Ebola situation some years back, and it was originating out of Africa, and that did not become a global pandemic because on a global level, people took the initiative to shut their borders. So, like, why wasn't that done in the early stages to shut their borders, shut all borders
Right.
completely to China, from people coming from China, regardless of if they're nationals of your country or not? They should have ride the wave out there so as not to bring the virus in, not to open any risk at all. They could have
Right.
employed the
Some
same
of us-
situation there.
And some of us advocated that. But again, people were thinking economics. At that time, they didn't know how serious it was. And they're thinking, shut your borders, you're crazy, you know, at that particular time. On second thought, it obviously would have made sense to do that. And I keep saying, if you had to do this all over again, that's what we would do, all right? But the fact remains, right? I think the difference is that with Ebola and the rest of it, because people didn't get vaccinated against Ebola, was it?
Correct. No.
Or SARS, people here didn't get vaccinated against it, yet we conquered it. And I'm saying that if you're isolated, just as you say, by closing borders, right, or, in my opinion, by testing a lot, widespread and quick testing, accurate testing, we would have had better results and with less dislocation. That's what I'm thinking. But generally speaking, and that's why I'm saying, right? I mean, if you're a developer of a vaccine, what incentive do you have to forget about your vaccine and concentrate on testing? You see, you know.
Well,
that's the whole point.
I think there's enough incentive considering the amount of mutations and variants that are out there. I think there's enough incentive
and that again is a problem because we don't know. We don't even know. That's why I said there are so many unknowns about the vaccine. We don't know if the current vaccination is definitely going to be effective against the mutations and so on that are going to come. We have to think beyond vaccination and think of ways to contain this. And I think testing, accurate testing, fast testing, widespread testing would do a lot more to bring back the economy of the world as opposed to vaccinating right now. I mean, I think it's something worth thinking of. I'm sure somebody has been thinking about it. I don't see the reason why not, okay? I certainly don't see the reason why not do the two in tandem, okay? But just a thought that I had.
All right.
Right.
Thank you so much, caller.
Thank you so much, caller, for your input. You're listening to Inside the News here on WINN FM 98.9. I'm Devon Cornelius, and I'm here with Kevon Brown.
Hi.
Kevon, let's take this last call, and we'll hear from our sponsors after. Good afternoon, caller. You're on Inside the News.
Hi, good afternoon, and how are you doing?
Well, thank you. How are you?
Good.
I'm doing great. Well, this is the first time calling in on this program for the year, so I'd just like to wish you and your family and the station the very best for 2021.
Thank you.
Thank you.
Before I move on, I would just like to ask three quick questions. Do you know anyone or do you know anyone who has the right to do wrong?
You want us to answer right away, or you'll just ask?
That's a very philosophical question. I need a lot of time to think about that one.
Do you know any country which is a heaven?
It's
And
a
do you
matter
know
of
any
perspective.
leader who is a god?
Well, that's a definite. Well, I think plenty of people would believe that Jesus is a leader and he is considered a deity.
Well, we are talking about earthly. We're not talking about the master, which we as a country owe him a tremendous amount of gratitude because he would have taken us through 2020. I mean, it was the year which I want to believe that no citizen would want to repeat. and it is behind us. We have come through it, and we are wishing the very best for this year. I just want to say, because of COVID, which it has caused the two big L's, two very big L's. It has taken lives, and it has taken livelihood. Take away livelihood. And this is something that we have to take very, very seriously. Very, very, very seriously. And I don't understand, people are still not taking this thing seriously. No, as I said, no country will get everything right every time. No leader will get everything right every time. But a country depends on its citizens. Just like, for instance, before Corona, it was against the law for anyone to wear a mask. Now today, the other way around, it is against the law for you to be in public and not wearing a mask. You see the big turnaround? And I want to ask a question in reference to the mask. If somebody is having an operation, would they want the surgeon to take off his mask? I would want to ask anyone that question.
Could you specify if you're having an if a surgeon is having an operation, you're asking if they should take off their mask?
Yeah, yes, because some people are indicating that no one should wear a mask. So the people who are caught
okay, yes.
performing the operation,
Understand what you're saying.
do they don't want them to wear the mask?
Right.
To secure themselves.
Right. And to protect you as well.
And when some people are saying that if you don't have corona, you don't have to wear the mask. You don't have corona, you don't have to wear the mask. They don't think that it is better for you to wear the mask not to get the corona?
Mm-hmm.
And you don't have to wear the mask only because you have corona. That's not the only reason you should wear the mask. You should wear the mask so you will not get the corona. That is the most important thing. Prevention is better than cure. And in reference to testing, it is not nowhere ideal where a government would be able to test everybody. It will not happen. It is a responsibility for every single citizen to obey the law of the land. Whatever. Yes, there are times when you use, I think there are times when you have to use your discretion. The discretion of the law and the letter of the law is very, very important. And as I said, which the only right a man has a right to do is what is right.
Right.
And when you do what is right, you will not be wrong. The reality is that, and now going into the U.S., which fortunately, not only the U.S., because people don't understand that what takes place in the U.S. would depend on what takes place here. And as I did ask you sometime last year in reference to who will win the presidency in America, that was a very important question and a very important position. And the embarrassment have 4 more days. Look at the mess that he would have created in the U.S. and in the world. Over 4,000 people dying in one day. Over 4,000 people.
Yes, caller. Continue to wrap up as you have other callers on the line as well.
Okay.
Yes.
So I just want to say that it's very, very important that all of us as citizens continue to play our part, our role. The government would have done an excellent job. The health officials would have done an excellent job. None of them are perfect, but what is most important that we can commend them for the leadership, the vision, and the management of what have transpired over the into last year, going into this year, and we just continue to pray for our country, our nation, our people, and may God bless this proud Federation of St Kitts and Nevis.
Yes.
Take care.
Thank you, caller, so much for your input. You are listening to Inside the News right here on WINN FM 98.9. We are the phone lines are now closed as we're going to wrap up this program. But before we do, let us hear from our sponsors, TDC Cable and the Caribbean. And then when we return, we will close out Inside the News. Thank you guys so much.
At The Cable, we know being local means supporting our own, and our customers deserve the best. Our customers deserve platinum. So now, all customers of The Cable qualify for our new Platinum Loyalty Card. An elite MasterCard experience that lets you support your own like never before. Instantly send money to any Platinum Loyalty member at home or around the world. Shop online or in person anywhere MasterCard is accepted. Save with no interest and 0 annual fees. And the best part? If you're a Cable customer, you are already pre-approved. Just visit the Cable building in Basse-Terre or sign up online at www.thecable.net. Get your Platinum Loyalty Card today because you deserve platinum. Terms and conditions apply.
Are you wondering what to do this holiday season? Will it be the same? Will you be able to give your family all that they need? Well, with TDC Financial Services, all your holiday woes will disappear. You can get up to $35,000 unsecured for your holiday needs. Give us a call at 465-6516 or 469-5430 to find out how we can help to make your holidays happier for you and your family. TDC Financial Services, where money is made easy.
Maybe it's the way the brilliant gold liquid reflects our sunshine, or how the bright blue of its label mirrors the clear Caribbean skies overhead. Maybe it's the fresh, crisp taste of this beastly cold beer on a scorching hot day. Maybe it's even the way it brings us all together. But one thing is for sure, Carib is very much a part of who we are wherever we're from in the Caribbean. Carib. It's the way we play. Drink responsibly.
People make the world go
round. Welcome back to Inside the News. Today's show was very, very engaging, and we really appreciate that engagement. That is the kind of discussion that we want on Inside the News when we're speaking about these circumstances that affect not just St Kitts and Nevis, but the region, the world on a whole. Concerning, I had one thing to say, and this will be my wrap-up statement for today. Our last caller talked about we having the right to do what is right. And I just wanted to play devil's advocate a little bit here and say that the concept of what is right is a socially agreed upon concept. So the concept of right can change depending on society or how society changes or how society is manipulated. So our ideology of right could completely change in the next 20 years, in the next 10 years. It probably has changed from the last 10 years, the last 20 years, the concept of right. So I think that was my 2 cents on the concept of right.
and thank you, Kevin. I wouldn't say I have 2 cents. I probably have 20 cents to add. But the time is definitely against us. And let me just join Kevin in thanking you guys so much for being a part of our program today. Inside the News, right here on your radio station. This is WINN FM 98.9. The engagement we received from you was very, very good, and these are discussions and engagements that we look forward to every Saturday. So thank you guys so much for being a part of the program. Thank you for your calls. Thank you for your questions. Thank you for your comments, your strong opinion. That is what we love, and that is what we believe in. Everyone being able to, or given that chance to share their opinion, regardless of how harsh it may be, or whatever, but that is your
or if
opinion.
They're conflicting.
Right, but thank you guys so much. And just remember, going forward, we are now on WhatsApp, so you can send your comments, your questions, your queries. So if you don't have any money on your phone, you can send a message to us, and we will receive that message via 662-2204. 662-2204. And of course, we have our regular calling numbers, but this is our WhatsApp number, 662-2204. Let me just end by saying again, thank you. Let me just say thank you, and continue to practice the protocols, continue to play your part in keeping St Kitts and Nevis safe from the COVID-19 virus, and don't let your guard down. I think when you do that is when things get out of control. We have our frontline workers. They're working extremely hard.
Yes.
They're working extremely hard. The nurses, the people at the entry ports, the CASPA, NASPA, you name it, they're working hard. And kudos to them, and we thank them for their efforts. We thank them for the work that they are doing. There were so many other things to talk about.
But we're out of time. Unfortunately, we're out of time.
So until next week, we hope to see you next week, Saturday, and bring a friend with you. It's going to be a very interesting and hot topic come next week, God's Way Life. You are listening to Inside the News right here on WINN FM 98.9 with Devon Cornelius and Kevin Brown.
Yes.
Thank you guys so much. Continue to stay safe and have a super Saturday. Thank you.
And a great weekend, too. Bye.
The Cable, we know being local means supporting our own, and our customers deserve the best. Our customers deserve platinum. So now, all customers of The Cable qualify for our new Platinum Loyalty Card. An elite MasterCard experience that lets you support your own like never before. Instantly send money to any Platinum Loyalty member